Surgical instruments. First half. Alice tissue forceps. It has a tooth tip. It grasps muscles, tendons, viscera, appendix, bladder. It has a look. The Alice forceps grasps muscles of neurosis and viscera. It is not used for grasping delicate viscera or vessels due to the presence of its teeth. Babcock's tissue forceps, like the Alice forceps but without teeth, and has fenestra in the tip of the blades. Grasps muscle, tendons, viscera, appendix, bladder. Babcock tissue forceps grasps delicate viscera, appendix, intestine. The Kocher tissue forceps might have a straight blade or a curved blade. It grasps aponeurosis, nails, bones. It is toothed. Its tip of the blade is toothed, and it is also used for crushing the base of the appendix during appendectomy. Kocher tissue forceps. Uh, cholecystectomy forceps grasps the cystic duct during cholecystectomy. It has a long handle and short angled blades near right angle. Cholecystectomy forceps grasps the cystic duct. Partial gastrectomy forceps, the Byers clamps, the small one crushing the pyloric stump and the large one for crushing the gastric stump. It has 4 joints. Partial gastrectomy forceps, crushing the pyloric stump and the gastric stump. Intestinal non-crushing forceps. It is non-crushing. The tip of the blades coapt first on locking. It preserves the intestinal vascularity. It has 2 long blades and it has a lock. Needle holder forceps. It has long handles and short, strong blades. Grasps the needles for tissue suturing. Needle holder. Sponge forceps. Grasps gauze, sponge, and uh, macerated tissues. It's also used for sterilization and preparation of the field of the operation. Scissors might be with straight blades or curved blades, sharp tipped or curved tipped, cut tissues, sutures, materials, mesh, etc. This dissect tissues, cut structures. Bone cutting forceps to cut bones. It is used to crush the prepuce in the operations of circumcision. It has no look. To cut bones used to crush the prepuce. photograph for crushing the previous and for another photograph for cutting bones. Crocodile forceps. It has no lock. The upper jaw is the active one on function. The upper jaw moves. The lower jaw is fixed. It grasps and punches deep tissues through cavities or excision or biopsy. Stone forceps for stone bladder and for stone ureter for stone extraction. It has no look. Groove director. It is used for protection of viscera on cutting the constricting rings of complicated hernias. It is used for lifting the tongue and protection of the lingual vessels on cutting the frenulum in case of the tongue tie. The groove direct, and this is the tongue tie. Yeah. For fistulography, we use the groove director. Groove director for protection of viscera. Urethral dilators for dilatation of benign urethra, a set of successive calibers. It has a curved anterior part. Blood transfusion set. The blood transfusion set has a filter in the bag of the fluid or the blood. It has a mesh bag filter to prevent transfusion of blood clots or blood for blood transfusion. Fluid infusion set has no filter in the bag for intravenous fluid infusion other than blood, not used for blood transfusion. Plain urinary catheter for temporary urinary drainage, for suction during uh, anesthesia or surgery, for tube drainage after surgery. Self-retaining urinary catheter, two types, the DePezard one and the Malicot one, for postoperative urinary drainage of the kidney or the urinary bladder. Self-retaining urinary catheter, the Foley's catheter, for the transurethral or trans-abdominal urinary drainage. It has a balloon to be inflated by saline injection after insertion to prevent its discharge or escape from the cavity it drains. Ryle's tube for gastric drainage, for operative field suction, for treatment of acute gastric dilatation. T-tube for postoperative biliary drainage. It is inserted into the common bile duct used for postoperative cholangiography also. Corrugated rubber drain for postoperative wound drainage used by cutting longitudinal strips. sterile negative suction drainage set. Collecting bag for collection of uh, biliary for any fluid, urine, collection urine, gastric secretions, or discharge from tube drainage. Good luck and best wishes.